A leprosy patient has got the worsening lesions and new appearing lesions. What you are seeing here are the type 2 leper reaction. So what is the drug of choice, doctor? Thalidomide. There's a diabetic individual. What are you seeing here? You are seeing a diabetic foot with a lot of slough. So how are you going to take care of that as a dressing solution? So we use Edinburgh's University solution of lime. Use all is the one which is typically used, and the composition of it is a bleaching powder, boric acid along with the distilled water. 48-year-old presented to the emergency with accelerated hypertension, and his CT scan, what is it showing? It is showing the aortic aneurysmal rupture. So typically you can see a dissecting aneurysm through the wall of the aorta, aortic aneurysmal rupture, and whenever aortic aneurysmal rupture is there with accelerated hypertension, you should not venture out to give hydralazine. Rather, ACE inhibitors, beta blockers, calcium channel blockers, they all decrease the shear stress on the wall and decrease the rapidity with which the expansion of a dissection occur, is what you have to basically understand. Can the second bar students can punch, where the voice is loud and clear, the online students? A patient presented with the features shown in the figure since 3 days. What do you see? One of the limb is typically swollen, which is a deep vein thrombosis, and there is a D-dimer test which is positive. So what is a way that you can prove? You can do the color Doppler, see the flow pattern, and whenever you apply pressure, there is a expected flow to happen. But if that flow doesn't happen, there is a clot in the vein. So that is what you will do. What is the most common infection leading to this condition which is being shown to you? Very happy to see Gautam and many more of the online students. So it is the Ludwig's angina, which is typically a feature which is often due to dental infection, is what I want to underscore. A patient has got dysphagia. His radiograph is being shown. And what are the features of this condition? What you are seeing here is a mega esophagus, a dilated mega esophagus, which is overlapping the shadow of the heart. A dilated mega esophagus typically occurs whenever there is achalasia cardia. Huh? Air fluid? Air fluid levels cannot be appreciated in this view. If you do the barium, then you can appreciate. So Birdbeak deformity, then mega esophagus, and Heller's cardiomyotomy, that is cardiac end of the stomach. But there will be no gastric air bubble because of the achalasia and a tight closure of the lower esophageal sphincter. The gas bubble in the stomach will be missing. So that's how you will recognize it. A child presents to the casualty with a high grade fever. For all the students who join newly, on your mobile phone there is a link given where you can see all these clinical images on your smartphone, right? On your smartphone. So that will give you clarity pictures. So we are going to, this is typically a pneumatocoel is what you need to basically remember. Shortly we are going to come up with a wonderful app which has features of Facebook, LinkedIn, Snapchat and news app, which is exclusively for the network of all medical students, doctors and senior consultants worldwide. So that through that you can make a link with your seniors who are there in different places, and you can exchange, you can have a free knowledge share, mentorship, etc., etc. So exclusive app for social networking for the medical students across the country and the world. So that's the plan. So there we will give a lot of clinical pictures in the real lifetime scenarios, and you can always quiz upon your diagnosis, everything. So Staphylococcus is known to lead to the development of pneumatoceles, is what you have to basically remember. Now a complete blood picture is being shown. It is a microcytic hypochromic anemia, which is typically seen in the case of thalassemia, iron deficiency, anemia of chronic illness, sideroblastic anemia, etc., etc. 30-year-old, undergone laparotomy 2 months back, and there is a scar. Typically, based upon the scar characters, you must tell whether it is a hypertrophic scar vis-a-vis keloid, which will be growing beyond the margins, etc., etc. They are all the differentiators. So that is the reason it is a classical example of hypertrophic scar, is what you have to basically understand. So soon after surgery, what develops is a hypertrophic scar. Improving with the time is hypertrophic scar. Remaining within the confines of the wound is a hypertrophic scar. And whenever the surgical scar, incision, cross the joints or skin creases at a right angle, that is a stimulation for a hypertrophic scar. And if you do surgery, it will improve without recurrence. And the incidence is more common for a hypertrophic scar compared to that of keloid. And it has no association with the skin color, whereas keloids are more common in blacks. We are neither blacks nor whites, we are browns. So what is this ECG in a patient who has got dyspnea? You have after the R wave, there is a negative deflection which is called S1. Then in the lead 3, before the R wave, there is a negative deflection which is Q, and there is a T wave inversion T. S1, Q3, T3 is the most characteristic feature on the ECG whenever, So Ashwini is asking, sir, what is the drug of choice for Lepre reaction type 2? Thalidomide, right? So pulmonary embolism, a 55-year-old with rheumatoid vasculitis, he is on heavy dose of steroids for a long time, now develops a groin pain and he is limping, and what is his MRI showing? Typically you are seeing there is a difference between the intensity signal of both the sides of femur. So avascular necrosis of femur. What is the most important investigation of choice for avascular necrosis? MRI. MRI can wonderfully delineate. Now, when you have seen through otoscopy a typical blue flamingo color of the tympanic membrane, the foot of stapes, is the classical feature of otosclerosis. In that you have a mobile tympanic membrane, Rini is negative, conductive deafness is found. So these are the classical features. Now what is this ECG pattern that you are seeing in the figure? What are the predisposing factors? So fundamentally, it is a ECG of hypokalemia. So what do you get in hypokalemia? Depression of the ST segment, T waves become biphasic, and after the T you come across U wave. Because of that, after T, next wave is U. Don't expect U to be a negative wave, because U letter is written like down, but U wave is a positive wave. But then why you called it as U wave? Because it is a wave that comes after T. Alphabets में T के बाद U आता. Because of the U wave, if you once more go through this thing, P, QRS and T. T is almost like a double biphasic T wave. So typically the GI loss, hypothermia, total parenteral nutrition, you get hypokalemia. Beta 2 agonistic agents which are used like salbutamol, which are asthmatic agents, they lead to hypokalemia. Whereas beta 2 antagonists like beta blockers, they lead to hyperkalemia. That is what you have to basically appreciate. Now what are the ECG changes shown in this figure is a side effect of. So there is a typical tachycardia, peak T waves are seen, which is the classical feature of hyperkalemia. So that's the reason. No, it's a question of hyper peaked T waves and all that. This is a hyperkalemic feature. So typically hyperkalemia is a side effect of trimethoprim. So that is what you need to appreciate. Once more, doctor, hypo, kalemia, calcemia, natremia, magnesemia, all these things you must be sure on the ECG. Simple rule you remember, all hypos prolong the QT interval, all hypers shorten the QT interval. That's a very important rule. Now, what is this fundoscopic picture? Typically it is retinoblastoma. So, the retinoblastoma's differential diagnosis include Coats disease, toxicariosis and retinal dysplasia, any of them. Now, what do you see in this clinical appearance of the eye, which is a very, very classical appearance? It is the fungal keratitis, a dry texture, satellite finger-like lesions with the immune ring is a classical feature of fungal keratitis is what you have to fundamentally understand. Now, these are the characteristic features of the which ocular condition that you are seeing in this picture. You can see at the limbus, corneoscleral junction, the presence of nodule-like things. They are called Tantrus spots, which is a feature of vernal keratoconjunctivitis. Whereas All's line is a feature of trachoma, not vernal keratoconjunctivitis. So conjunctival scarring is called All's line. Now what is this presentation? It is a vertex presentation. So what are the diameters of engagement? One is biparietal diameter, second is suboccipital-bregmatic are the two diameters through which a vertex presentation basically happens. Then in the histopathology, what do you see in the epidermis? This reminds you a sawtooth appearance of the inflammatory infiltrate. So this kind of a sawtooth appearance is a feature of lichen planus is what I want to underscore to all of you. A 70-year-old slipped from the bathroom, her radiograph is being shown to you. What do you have? This side it is normal, but if you come to this side, there is a trochanteric fracture which got displaced. So what is the most accepted modality of treatment for all such scenarios? Dynamic hip screw is considered to be the treatment of choice for an elderly patient who has got a displaced trochanteric fracture is what you need to remember. A ultrasound is being shown. So what is this called? Lambda sign. Can you appreciate the lambda? You can see it is going up and then coming here and it is going like this. So this is what? The letter lambda. Whenever lambda or a twin peak sign, it is called twin peak sign, is found, then it indicates dichorionic, diamniotic twins is what you need to basically remember. Now what is this lesion which is being shown? It is fundamentally a ulcerated sebaceous cyst which is also called Cox peculiar tumor. It is one of the earliest, can check this monitor, earliest pages of Bailey and Love, Das and all these books. Now this is an orthopedic gadget which is being shown in the figure and a radiographic appearance of it is also shown. It's called Herbert screw. So what is the purpose of Herbert screw? So fundamentally a Herbert screw, it will provide a compression against the fracture site, and for intra-articular fracture if you want to fix it, it will help, and it has got a differential pitch mechanism is what need to be basically remembered. Now that is the story of image based questions. Let the notification come, we will see how many they love to ask image based questions. Most likely we are expecting at least 50-60 questions. Worst case scenario, it won't be less than 25 on the lower end. On the higher end, it can reach up to 80-90, whatever the craziness of the examiner could be. But really doesn't matter. If you know the concept, high yield issues, you know what examiner is asking you, within no time you can guess and hit the jackpot. Yeah. What is bony labyrinth? The remaining questions are skating. Compact bone. Osseous labyrinth is made up of compact bone, and cancellous bone is highly vascular. What is the nerve supply of gemellus, inferior muscle? Typically, superior gemellus is nerve to obturator internus, inferior gemellus is by nerve to quadratus femoris, is what you need to basically remember. About the spring ligament, tibialis posterior is the one which will support the spring ligament. Then epiploic foramen roof has got the caudate process of the liver. You must know all boundaries, inferior, left lateral, etc., etc. Torus aorticus in right atrium, what is it basically due to? The right posterior sinus and the cusp of aortic valve. The point of confluence is the place which is called torus aorticus in the right atrium. Now, for equilibrium, gait and etc. and learning induced changes. For example, you started driving car. You know how to guess the distance, how to not run into the other car and all that. All because of the vestibulocerebellum. So you have archicerebellum, vestibulocerebellum, neocerebellum, all these things. Cerebellar structure, cerebellar histology. They are the high yield areas for the NEET PG. The cold temperature regulation is controlled by which part? All hypothalamic centers, you should be sure. Anterior will be warm, right? If you are very hot, you start sweating. That's because of the anterior hypothalamus. If you are very cold, you will be shivering. It is because of the posterior hypothalamus. How will you remember? Shivering in the spine, they say. Sweating on my face, we say. Face is front, anterior. Shivering is back, posterior hypothalamus. Cyclic AMP is the secondary messenger for calcitonin. So you must know secondary messengers and what are the list in the Ganong. Pocket mein rehna when you go for exam. So every Sunday, Monday, Tuesday we have a day-long session, 9 to evening 6 o'clock. Excellent teachers across the country come to Hyderabad and deliver a lecture for you. All that last 15 years, All India NEET PG question bank discussion is there. We throw all those discussions into video library. Please do review that. So, what is the time required to complete all migrating motor complexes? It's a stupid question, purely numerical. You don't know, that's all. 100 minutes. Then which is not an appetite suppressant. If you take the ghrelin is released by the stomach and during the fasting, and it stimulates the appetite. Leptin is produced by the fat cells, adipose tissue, and it will inhibit the food intake. Right? So that is very, very important. Lot of times those who are having unmanageable obesity, we keep saying eat less, eat less. Actually they eat less only. Because their own adipose tissue will start telling them eat less, eat less, eat less. On the top of it you are depressing them. Eat less. Then the depression can make them to eat more. So don't depress them. Right? So melatonin is synthesized. These are all lifestyle problems. You think that poverty brings rheumatic fever and overcrowding of living. They are one end of diseases. Other end, prosperity will make your life sedentary. And when you become sedentary, the problems that come, obesity, colonic carcinoma, endometrial carcinoma, this is the other end of the spectrum. Both are called malnutrition, right? So melanin is synthesized from tryptophan. Transamination require pyridoxine. Then carboxylation reactions, we have biotin. Now the vitamin A of all the various forms, it is the isoretinoic acid which is most active form, which has an action on DNA. That's the reason we use all-trans retinoic acid, ATRA, in the clinical management of APML, acute promyelocytic leukemia. Then it is a retinol, which is the active form of the vitamin A. So how to recognize Streptococcus? Next Sunday you have a day-long session by Dr. Khalil, who is like God in microbiology, right? So he is going to discuss last 15 years All India NEET PG question bank of microbiology. Do you know highest number of questions in the last 15 years are asked in which topic? Streptococcus. When you open microbiology book, first topic you should read is Streptococcus. You don't read anything else, only read Streptococcus still. 2 marks out of 15 or 20 marks in NEET PG is guaranteed. Similarly, chlamydia is a very high yield topic. Clostridium is a high yield topic. Vaccination high yield topic. Immunoglobulins high yield topic. Like that, not more than 25 topics you are ready. Almost 18 out of 20 marks you can hit in the NEET PG and come back. But know what are the high priority topics based on analysis. Let me tell you, right? So it is optogen sensitive, bile solubility positive, alpha hemolytic, but it is bacitracin test negative. The bacitracin test, why do we use? To differentiate beta hemolytic group A streptococci from the beta hemolytic non-group A streptococci. Most of the streptococcal infections are all because of the group A, beta hemolytic streptococci. Your sore throat, blah blah blah, everything. So the bacitracin can differentiate. One more reason why we can use this, even in staphylococcus you can use. Bacitracin resistant of staphylococcus, bacitracin sensitive will be micrococcus. To differentiate staphylo from micro, also you can use it. Then optocin, it inhibits the pneumococci, but not alpha hemolytic, other alpha hemolytic streptococci. So, which cocci are alpha hemolytic, what are beta hemolytic, what are gamma hemolytic, all the table of gram staining and tests are there, no? You should master that. Bacteriology entirely lies on that. Then if you take gram-negative organisms which are indole positive, which are lactose fermenters, which are late lactose fermenters, non-lactose fermenters, 50 साल से यही चल रहा है. Every time students microbiology means constipation आता है. वो पढ़ने के लिए लेथार्जिक हो जाते, ये भी पढ़ना है वो भी पढ़ना है, मगर पढ़ना है खाली एक ख्वाब रहना, that I want to be the best CT surgeon, neurosurgeon, I want to create a world's largest hospital. Only that killing attitude, faith, trust on yourself every moment, that is the only differentiator between the people who win and who give up. So there is no failure until you stop trying. There is no success unless you keep it. So you may read, but unless you take some chance of quizzing with your friends, revising whether I remembered the chlorine dosage or not, at least until entrance, whatever you read will go into soil. So both the things you should do, create a balance and you will definitely win, be sure. Now doctor, Shigella. Which one doesn't ferment the mannitol? Dysentery. So, Shigella dysentery, it does not produce catalase, does not ferment mannitol. Soniae, it is a late lactose fermenter. Flexneri, it produces the gas. And all Shigella, except the dysentery, they ferment the mannitol. That's the point you need to differentiate. Nothing of this requires intelligence. It requires sheer willpower to read them, remember them, reproduce them. That's all. And forget them after getting seated. Why do you need? If you are a gynecologist, do you need Shigella, flexneri, releases gas or which will eat food? All this is required. No, not at all. Right? So, but still this filter. When you are passing through filter, no emotions. It's a game. It's like cricket. Right? So, and you should not insult your brain. Hey, my friend knows that Shigella dysentery doesn't ferment. I don't know even there is a test like that also. There is a Shigella also in microbiology, we don't know. Right? So, कौन सा सब्जेक्ट में आता बोल के भी पूछ देते हम. Our entrance पढ़ने में one of our classmates used to be there. That fellow is now a urologist. मेरे समझ में नहीं आ रहे रे. एक कौन सा सब्जेक्ट में आता? Looking at him, he used to get confidence. At least we know which subject it belongs to. Right? That's the reason you should go to reading room. Now, what is the most important vector of leptospirosis? Redis ratus. Gas gangrene, any of them, not only novii, any of them can actually produce. Aseptate hyphae and asexual spores is the feature of zygomycetes. So once more, pseudomycetes, eumycetes, etc. You must have a look. This is actually 9th class biology CBSE syllabus का table है. MD entrance में भी यही पूछते. Trichophyton affects skin, hair, nails because they are the three structures we are made up of. Then which fluoroquinoline crosses the blood-brain barrier maximally? Pefloxacin. Then especially for typhoid, ciprofloxacin alternative would be pefloxacin. Ceftazidime is called the anti-pseudomonal penicillin. So ceftazidime, cefepime, ticarcillin, piperacillin, imipenem, estrionam, gentamicin, tobramycin, amikacin, and the ciprofloxacin, which is a second generation fluoroquinolone. They are the armamentarium that you have to fight against pseudomonas, is what you need to basically remember. Terbinafine is fundamentally called antifungal. Which IV drug can be used to manage hypertensive emergency? Esmolol, sodium nitroprusside, hydralazine. Whenever accelerated hypertension with hypertensive emergency is there, you can use any of them. Now, it is a lidocaine which decreases the action potential in the Purkinje fibers and hence used as an antiarrhythmic. One important area you need to go and revise immediately after going home if you did this question wrong. How many did this question wrong? Can raise the hand. One. Come on, let's be sportive. Only one. All you four answered right? Come on, yeah. Sure? You are not saying yes or no. You all did right. You didn't attend the test, okay. So, but let me tell you, if you did this wrong, go home, review antiarrhythmics. That's how you should improve 20-30 topics every week. Endothelin receptor antagonist will be bosentan. And whenever a patient has got pulmonary hypertension, problem is at the level of the endothelin level, excessive pulmonary vasoconstriction. So we use bosentan. RH incompatibility is a antibody which is going and attacking a fixed antigen, hence type 2 hypersensitivity. Then acute hemolytic transfusion reaction can occur against RH, Kell or Duffy. Duffy dies, Kelly kills, Lewis lives. Lewis blood group, it is not mortal. So Duffy dies, Kelly kills, Lewis lives is the adage you need to remember. Amyloidosis typically lead to development of a restrictive cardiomyopathy. Now, the tissue factor endothelin 1 A's, they are all the ones which are typically affected in the cascade of reaction that occur in the shear injury. Now, T cell dependent antigen and tubercular antigens IgG and IgA are the ones which are stimulated. P24 antigen is the one which appears very early. Smoking de-addiction we use varenicline, and it is also used to treat it is used to treat nicotinic addiction, which is another very big global problems. Alcohol and smoke, to give up, people struggle and the family is ruined because of alcoholism, and many people who are unable to give up the habit of smoking, they are the biggest troubles in the community. So there is a snake bite, and the rap pressure must be how much in the upper and lower limbs? Too much a question. 40 to 70, 55 to 70. टेलर जॉब का काम है ये, ऊपर कितना लेना नीचे कितना लेना, then what is neutropenic fever of unknown origin? 500 is the count below which typically ionized therapy, pyridoxine deficiency, riboflavin deficiency, secondary niacin deficiency occur in all these conditions, even in carcinoid. MEN2 is an autosomal dominant condition. Wilson is autosomal recessive, hemochromatosis is autosomal recessive. For the Legionella, what do you use? Azithromycin is the one which is used. Now 100 mg of single dose of mebendazole is the best treatment for which condition? Enterobius vermicularis, classically. Mainly to prevent auto-infection, which is the main problem of Enterobius vermicularis. Proteinuria more than 25 in 25 hours is basically called malignant proteinuria. MCHAT is used as a screening for autism. So MCHAT has got a 23 items where yes or no checklist is being given. There is one more called Guilliams-Asperger's disorder scale. Mongolian spots commonly are in the presacral area. Now there is a hypoglycemia. What is the immediate treatment that you want to basically give? 100 mg per kg per day of 10% dextrose is considered to be the management of choice. When do you call as normoglycemia? There is a difference between the definition of normoglycemia in a newborn baby versus adults. 40 to 50 also is called normoglycemia in case of a newborn baby, be very sure. So we give 2 ml per kg of dextrose, 10% solution intravenously followed by a glucose infusion rate of about 6 to 8 mg per kg per minute. In iron deficiency, reticulocyte count, when will it increase if you start the iron therapy? Typically within about 4 to 7 days after the initiation it will increase. In a newborn, what is the best way of transport of a newborn maintaining the warm temperature? It's called kangaroo mother care. One of the favorite question asked in the exam. 1 to 13 years, if you want to know the age, where do you want to look for the ossification centers is important to know. Wrist is the best place. Shoulder is the best in infants between 3 to 9 months. Hand and wrist between 1 to 13 years. Elbow and hip is best between 12 to 14 years. So this is what you have to basically remember. Cloudy cornea is not a feature of Hunter. If the cornea is clouded, how can Hunter can hunt? है ना? अर्जुन का आंखें एकदम तलवार के तार के जैसे तेज रहना. Now, rumination disorder. Rumination disorder means few people after they eat food, they will start bringing out the boluses of the food back into mouth and then they once more swallow it. It's a very, you go to YouTube and type rumination disorder. If you look at those videos, you don't feel like eating anymore. But it is actually a, if they do few abdominal, it is not reflux. It is not a reflux disorder. वो खाली pharyngeal level तक food जाके वहाँ रह के they keep regurgitating and then once more they swallow that. Right? At most the teeth get spoiled. Because of that, and it's very difficult for the people around them. Right? Because what the food in the party is already digested by them and the friend of them is bringing it out and then swallowing it back. Rumination disorder. But if they do few abdominal exercises, biofeedback, then they will overcome all that. Shall we call it a day?